Dr. Abiola, we were not working. I mean, we were
Yeah,
not on holiday, we were working.
we're
We were
not
not,
on no holiday, no rest for the wicked.
no, no rest, oh, no rest for us, no rest for us. Wow, wow, wow. Okay, how are you? What's your plan for today besides work?
uh, Besides work, I am going to play with my kids. We're going to ride bicycles.
Oh, nice. Oh, you can ride. Me, I cannot ride bicycle. Though.
Really?
I really cannot. I don't
So
know
that
how
means
to ride it.
you can't swim, right?
I can swim, but
Oh,
is it
okay.
the same?
No, 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 no. I just
Uh-huh.
thought that if you can't ride a bike, you definitely
I
can't
can
swim.
swim. I don't swim as
Okay.
often as I would want to, but yeah, I can swim. I just can't ride a bike. And my plan was to learn to ride a bike before my birthday this year, but that before my 40th, but that did not happen. So I don't know. Maybe before the end of the year, I begged that they should buy bicycles.
Does your husband know how to ride a bike? Is he going to teach
He
you?
does. My kids can ride bikes. I'm the only one. So if anything happened to us right now, I'm the one who's going to be left behind because everybody.
They should they'll jump on their bike. They should just put you on a bike and roll you down the hill. You'll figure it out before you get to the
Yay!
bottom.
No, that's wicked. And so
That's how
here's
I was taught.
yeah. When I was younger, we used to go to my cousins in Port Harcourt, Shell Camp in Port Harcourt, and we used to ride bikes. So I did learn to ride a bike then, but I won't say learn, because I was always falling, making mistakes, stumbling. But I don't think I ever finished. But then came back to Lagos. We didn't have a bike at home. I don't know. Sha, my siblings can ride. I cannot. My children can ride. I cannot. God will help me. Maybe before the end of the year, I will learn how to ride a bike. Maybe. But I have to get a bike first. That's the
Yes.
first step. Let me beg him again. Maybe he will help me.
There's,
Anyway,
there's a
let's
good
get it.
place in Ikeja. I'll send you the contact
Okay.
where you can get a good bike for.
Okay. Okay. Alrighty. Alrighty. Thank you. All right. We're going to be talking about the importance of comprehensive screening this morning. You already heard the voice of our doctor, Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. This is Women Radio. This is Radio Doctor. You already know that we're live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. You can send messages to 0703 1756 537 messages or voice notes. We've said you can start sending your voice notes 0703 1756 537 or 08155 917 917. Those are the numbers to send. The phone lines will be open shortly. When they're open, you can call to ask Dr. Abiola your questions. Okay, let's get into it this morning. Dr. Abiola, what exactly is comprehensive screening and what does it mean in healthcare?
I always like to back up things with statistics.
Yeah.
When we look at what they call non-communicable diseases, those are diseases that you don't, sexually transmitted, or you don't cough on somebody, pandemic type diseases. When you exclude those, 75% are in heart disease, stroke, cancer, diabetes, and lung disease. And many of these conditions are silent before the symptoms appear. And by the time the symptoms appear, it could be extremely advanced. But that's the importance of comprehensive screening. Comprehensive screening is really checking a healthy person before disease becomes advanced. And it's not just one test, usually it's a planned medical review. So we're doing that in our lab now. We're encouraging people that come in off the street to do lab tests that they should have a consultation. We're doing it free. Have a consultation so that the doctor can identify risk factors, can identify, ask you different questions so we can target things to include in the comprehensive screening. But it definitely means we're not looking for only one illness. We're looking at the person as a whole. So from the heart, the kidneys, the liver, the blood, hormones, reproductive health, and family history, like I mentioned before, all of those things are very important.
Okay, thank you so much for that. So why is comprehensive screening important, even when we feel healthy? And I know that this is just, anybody that's listening, like, people ask these kind of questions a lot. Well, it's do good. So that it's good, just to remind us, just to reinforce, these things. So why is comprehensive screening important, even when the person feels healthy?
Yeah, on this show, and we'll say it again, on this show, we've talked about hypertension, high blood pressure being the silent killer, right? So high blood pressure you can have high blood pressure for years before you have your first headache, or having chest pain. Diabetes can damage your nerves, your kidneys, your eyes, um, blood vessels for 5 years, 10 years before a person
Mhm.
feels very sick or goes into a crisis. Even with, I think when we talked about cervical cancer, I mentioned this, that most of the time when I see cervical cancer, it's stage 3 or stage 4. It's highly advanced because the precancerous changes start long before the bleeding or the pain, which is what normally brings people in. So it's important to note that's why feeling healthy is not the same as being medically healthy. And this is why the
Mm.
importance of screening is like, I feel fine. I feel fine. Yeah, but
Doesn't mean
medically,
that you're medically healthy.
exactly. And so screening helps us catch disease when treatment is easier on both of us, the patient and the doctor. It's cheaper. People need to remember that they're always trying to save money, but it's always cheaper to treat the disease in the beginning. And it's obviously far more successful when we screen first.
Hmm. So besides cervical cancer, maybe what are other diseases or conditions can screening help detect early? You mentioned
Yeah.
headache before the high blood pressure, but what other diseases and conditions can be detected?
It's estimated that a third of Nigerians have high blood pressure. A third.
I
A third.
believe.
So so that's the number one thing we can detect is high blood pressure. That reduces your chance of stroke, heart attack, um, congestive heart failure, all those kinds of things. The comprehensive screening can help you with diabetes and pre-diabetes. If you can catch some of these diseases early, you can prevent them from being converted over. Of course, we check cholesterol. I'm trying to go in order of most important. So high blood pressure, blood sugar, cholesterol, kidney, liver, right? And women, it's very important to check their blood level PCV
Mhm.
because they menstruate. They may menstruate heavily. They may have something called anemia. We talked about this on the show before, hepatitis.
Mhm.
So you check for hepatitis B and C and HIV
That's
where
it.
it's
Yeah.
deemed appropriate. We talked about HPV, human papillomavirus, that causes greater than 90% of all cervical cancer. So screening for cervical cancer, knowing your cervical cancer risk is part of it. Breast cancer risk, and of course, my favorite, prostate, right? Prostate problems in
Like
men.
you said, my favorite one.
All I used to do was prostate before the people recognize this place for infertility. So that's half and half
Um,
now. Then
right.
and then if you're pregnant, you have a whole different set. It's important. Anemia, high blood pressure, gestational diabetes. You have pregnancy-induced hypertension. All of these things fall into the screening categories. My
Okay.
major point is that screening does not need to wait for the disease to announce itself. The disease does not need to give you a warning sign before you start screening, and seeing early warning signs really can help before complications start.
Okay. So what age can you we typically talk about, the ages to start doing certain things, maybe to test for cancer, and all of that. So what age? Is it when you're an adult, or does screening start from like childhood?
When did you become an adult, by the way? Is that, when does somebody become an adult? I don't know if I'm an
The
adult
way
yet.
I understood that question was like my mom asking me, "Nígbà wo lo dàgbà?" Like that kind of thing. That's how it came up.
Exactly.
18, is it 18, the year where we
Well,
become
that's
adults officially? Even though I know that an 18-year-old is still a child, that's just it. You cannot tell me that you're an adult at 18. Maybe 25, maybe 21. Even 21, your frontal lobe is not even well developed at 21, maybe 25. To be honest, we're all
so.
still reading.
I'm happy you mentioned that. I'm happy you mentioned that. That's an aside from this topic, but your development. First of all, women develop a little faster than men,
You see?
and
And
most
people don't
people
give us our props.
they're
I digress.
not formed. That frontal lobe is meant to affect our decision making, curb impulse if the behavior, all those kind of things. And it's not
Yeah.
fully developed until 25, or at least that's why you see people that get addicted to drugs before the age of 25, they suffer harder to get rid of, to drop the
Hmm.
habit than those that started late. And it's because it changes your brain chemistry so much more. So anyway,
Right. Okay. So what age should
so
screening start?
for technical purposes, adult 18 and above. So
Sorry,
everybody from age
you're
18.
breaking up, Dr. Abiola. Oh,
Um,
is it me breaking? I don't think.
how about
I
now?
didn't catch your answer. What age screening should start?
Bro.
You said for technical something something. That's
Yeah,
all I had.
for technical reasons, from age 18. We're going to call
18.
18 adults, and, and every adult should know their blood pressure. They should know their weight. They should know their BMI, that's body mass index, and they should know their risk. What are they at risk for? Does my mother have any chronic disease? Father, uncle, aunties, do they have any chronic diseases that may affect me? And then, at the bare minimum, at least once do a blood sugar. So that's at age 18. And usually for those people, we test maybe every few years, as long as the first one is normal, right? But it starts becoming a little bit more important from age 30 to 40. It needs to be a little bit more structured.
Hi,
And now, is it working out?
can you hear me now, Dr. Abiola?
Yes, I can hear you. Welcome back.
It is my everybody's home today, so my network is dragging because everybody's now on,
Oh,
and then my data service is just acting drama this afternoon, this morning.
mine,
So
mine too.
yeah, so sorry.
No, mine is doing the same.
I think that happens when people are home. It's like, oh, everybody's at home, so it drags or
It's
I don't know.
streaming
But yeah,
movies or streaming videos. Yeah, they can slow it down.
yes. I think that's what it is. Okay, let's get into it. So I'm so sorry. I think where I heard you said 18 would be a good time to
Yeah, to do your first checkup, and
18 is
it
a
can be
technical age. Yeah,
yes,
for
that
this.
technical age. Yeah, so technically we'll use age 18. We'll call you an adult, right? So from 18, every 18-year-old should know their blood pressure. They should know their body weight. They should know BMI, that's their body mass index. And I think more importantly, they should know their basic risk profile, meaning what things am I at risk for genetically? What kind of things am I at risk for because of where I live or what I do or my conditions at home, so that you carry that medical history and pre-medical history with you everywhere you go from age. And then if it's normal, if everything's normal at 18, then we now make chance we maybe check it every 3 to 5 years after that. Becomes a little bit
Mm-hmm.
more important from age 30 to 40. We now need to become a little more structured in our screening, especially because we want to start looking at blood sugar, cholesterol, kidney, and liver functions. We want to ask about sexual history, whether or not there's a cancer risk. We
Mm-hmm.
talked about HPV, human papillomavirus. So, and also we've talked about breast cancer. So we want to start really hammering home the importance of those screening tests. And it becomes far,
Okay.
far more important from, I'm not saying the other ages are not important. I'm just saying it gets increasingly more important because you start seeing chronic disease as you get older, right? So from age 40 and above, I preach to all my patients, treat yourself. To your birthday present, to your first birthday present should be a comprehensive health checkup.
Yeah.
Well, from age 40 and above, it should become more like a routine rather than, there's some one-off thing you do here and there. And the same things we're looking for: high blood pressure, diabetes, heart disease, kidney disease, and cancer risk. People listening have to understand that cancer is not one test. You can have cancer of anything. You could have lung cancer, brain cancer, testicular cancer, and each of them have their own way of screening for them. So this is why sitting in front of a doctor that's good clinically to try and tease out anything in the family history or any symptoms you may have ignored, so we know exactly what to look for, is quite important.
Okay. Thank you so much, Dr. Abiola. Next up, we have, are there specific screenings recommended for women at different life stages? So I know when we did the cervical cancer one, you had given us the age, but are there different ages for different, what do you call it? Age, yeah, groups of women, ages of women, etc., etc., etc.
Yeah. We talked about if you can get your HPV vaccine, that's against the virus that causes cervical cancer. If you can get that for your children between 9 and 12 before they become sexually active, it's more effective. But in adolescence and early adulthood, let's say pre-20 years old for women, of course, we want to look at general health, want to look at if they're having any menstrual irregularities. Of course, if they're having heavy menstrual periods, they may have anemia. You believe how many, you won't believe how many people walk around here anemic, meaning low blood level, usually low iron, and they have low energy, they're fatigued all the time. By the time you bump those levels up with diet and supplements, you see them doing much better. So from age 20s to 30s, we're looking at cervical cancer risk, doing our pap smears and our HPV blood tests, sexually transmitted infection screening. You should be learning how to do self breast exams, like how and when you examine your breast for lungs at home. And then, we'll still do general metabolic health, meaning blood pressure, blood sugar, etc. In pregnancy, screening becomes more frequent and it's using more specialized. So we're looking at PCV, we're looking at the urine analysis, we're looking at blood pressure. And from 40 years and above, just like with men, this is where cancer screening really comes into importance. So breast cancer screening, blood pressure, diabetes, cholesterol, kidney, 55 is average. It's the average. 55 is average. It's the average.
Is that menopause or perimenopause? Is that menopause or perimenopause?
So perimenopause would be from 40 to 60. Just around.
Oh.
Yeah, but it's average. I've seen women go into menopause at age. Yeah, but it's average. I've seen women go into menopause at age 41.
I know that this is not a menopause conversation, but what's the difference between perimenopause and?
So as your hormone levels are decreasing, you now enter into perimenopause. When they get very, very low, you enter into menopause. Usually in perimenopause, the woman's cycle starts elongating. It goes from 28 days to 35 days to maybe 60 days. It starts having more and more space in between until eventually it ceases.
Okay. All right. Okay. Moving on. And then so you mentioned the screenings that are important during pregnancy, and I think that a lot of women don't realize how important these screenings are. Say that again.
I said I can put a few more for if you want to just talk about pregnancy. There's a couple I didn't say.
So please go ahead. Because a lot of women don't realize the screenings that they're supposed to do.
Extremely important to tell everyone, try and get registered by 12 weeks and run these tests. You will be grateful for it. So your blood group, you should know in case you need blood down the road. You should know your genotype. You should know your PCV, that's your blood level, to make sure you don't have anemia. Talk about blood pressure, blood sugar. You to check the urine. Um, HIV, hepatitis, HPV, syphilis, all of that, all of those sexually transmitted diseases are important because you can, as a mother, if you're active, you can transmit that to the baby. You know, hepatitis B can transmit it to the baby. Hepatitis C can be transmitted. So you want to
Mm.
screen for these so that if we know we're going to do maybe a CS or we're going to treat you before you deliver, all those kinds of um, all those kind of options are open. Of course, we're checking for malaria and rhesus antibody, but it's especially important in Nigeria because there's so many. Um, I don't want to disparage anybody, but Nigeria has a large number of maternal deaths, where Nigerian women face a much higher
Yeah.
lifetime risk. You know, so
Yeah.
compared with women in other countries, so it's important to get this message across.
Yeah. Very, very true. Very true. So, from all that we've said so far, it's safe to say that comprehensive screening can help prevent serious illnesses, or better still, can help detect them early so that it doesn't get to a fatal point, and that's when you're just coming to the hospital, right?
Yeah, it can do both. The best example I'll give is pre-diabetes to diabetes. So if you do a fasting blood sugar is above 126, we usually call that diabetic. Sometimes you do a fasting
Okay.
blood sugar and it's 108, 108. It's above the normal. Normal should be 70 to 100, but it's not up to that 126. So that 100 to 125 is where I usually stick to people that are pre-diabetic. And if you concentrate on
Mm.
the lifestyle changes, it can often prevent prediabetes from becoming diabetes, right? If
Mm.
blood pressure is found early and treated, you can treat it before it damages your kidneys and your heart. You
Right.
know, and for example, if cervical cancer is detected early or pre-cervical cancer, pap smear can detect what they call dysplasia or cells that are just starting to change, precancerous
Yeah.
cells. If it's detected, you can just remove them. It's a very quick procedure. But if it's not detected and the person comes, then you're not talking about chemo, radiation with a 70% chance of death within 5 years. It's so different, your prognosis when you've caught the disease early versus when you're presenting late. So it's not just about diagnosis, it's prevention, early intervention, long-term protection. That's really what we're after.
Right. Hmm. Thank you. Thank you so much, Dr. Abiola. Also, another question would be, what about family medical history? How does this affect, or does this affect at all the type of screening a person needs?
So very, very, very important. I had a patient just a few days ago that I had to counsel on this. Came in, he's on admission, very sick, drinks a bottle of Ubagoro a day, has high blood pressure, uncontrolled. I asked him when he used his BP drug last. He said 3 or 4 days ago. I said, why? I just thought it was going to be okay. I said, now, tell me about your family history. Everybody in his family on the mother and father's side has high blood pressure. I said, and
Yeah.
you are playing with it? And you're playing with it? Really? He has a couple people with diabetes. I said, do you have, why don't you check your blood sugar? Okay, do you know what prostate is? And prostate cancer doesn't even know what it is. And this is
Oh.
common. So if
Mm.
you have a father that had a stroke at age 55, you should
Yeah.
not wait until 55 to start checking your blood pressure and cholesterol.
Mm.
If a woman has a family history of breast cancer, you should not wait until you have a bleeding breast lump or see bloody nipple discharge before you do a breast assessment. So
Mm-hmm.
family history can really push you into, can really help you guide your screening process. You know, I know what runs in my family, and so I check those things every day. It's
Thank you.
not, I do it every day, like my blood pressure, I know, and then some other things we check. So it doesn't mean that the disease, just because it's in your family history, it doesn't mean that it's certain, but it does mean that your risk is higher. And it means that screening should start earlier. So if you have somebody with a strong family history of heart disease, high blood pressure, diabetes, I wouldn't wait till 40. to start doing my annual checkups. I'd probably start
Right.
at 30 or 35.
Right. I mean, that makes a lot of sense. Because as you were speaking, I was like, "Ah, I need to call my mom. I'm not sure.
Hmm.
But I'm not sure what it is and what history we have. I don't know if it's a history or if it's old age history we have. I know the one of glass. I don't know. I don't know. I want to call my mom to ask her. So yeah, I will get into that. See, I'm getting into it. The number to call is 07000 or 09155 to call us to ask Dr. Biola questions on comprehensive screenings, what to look out for, the type of screenings to do. That's what we're talking about this morning. This is still Radio Doctor on Women Radio 91.7. And you know that Radio Doctor is Nigeria's first specialized health program where doctors come on here and advise and consult for us for free on Women Radio 91.7 FM. We are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. Right about now, the time is 26 minutes to 11 this Friday morning, this new year, new month, Workers' Day. First day of the month and Workers' Day simultaneously. Okay, let's get into the next question with Dr. Abiola, who is the MD CEO of ROA Specialist Hospital. A lot of people avoid hospitals. I feel like I ask you this question every week. A lot of people avoid hospitals. What are the risks of skipping regular screenings?
Well, the biggest risk is getting a late diagnosis, and
Yeah,
late disease is almost always more expensive, more
mhm,
painful, more difficult to treat, and is less likely to have a good outcome. So
right.
when people skip their screening, and they usually only come to the hospital when complications have already started. That's why somebody may first discover high blood pressure after a stroke, diabetes after there's a wound on their foot that doesn't heal, kidney disease when their face and their legs start swelling. These are all late disease presentations. I know part of it in Nigeria is that a lot of people still pay out of pocket for healthcare, so late diagnosis can become a financial crisis, right? You may think, there's a saying, penny wise, pound foolish. So you may
Yeah,
think that by skipping these screenings, you're saving up money, but when the thing hooks you, that's what I'm saying I did. When it hooks you, you will
yeah,
know that you really know cost. Then it may look like an expense screening, but it's usually cheaper than emergency care, surgery, dialysis,
yeah.
ICU, or even long-term disability. So that's the main thing.
Right.
Late
Okay.
diagnosis. Late diagnosis is terrible.
Okay. So how affordable, let's come to cost. How affordable and accessible are these comprehensive screenings in Nigeria today? You can use RA as, especially for people who don't have, HMOs and
Yeah,
everything. They have a
I,
limit to what they
yeah.
cover. Yeah.
I
So yeah.
treat a, I treat a lot of people. Um, I'm in my office. I just reached on my desk. I'll hold this up for the camera just briefly. It just shows that for our typical comprehensive test, we list so many different tests we're doing. The basic test is probably about 30 different tests you're doing all the way up to the executive. You
Yeah.
can pay anywhere from 150 to 300K for a full comprehensive exam. But what I do as soon as I show the people the form and say this is what I'm suggesting, first thing I now do, I didn't do this before, but it's very important in Nigeria, is that price okay? Because they can get to the front and say, oh, I'm coming, and then skip everything thinking that that's the only option. And it's not. If if affordability is a challenge, then I'll sit down with a person and just especially ask so many history questions, family history, blood pressure, blood sugar, and we can now just do things that can fit their budget. Of course, your blood sugar, your blood pressure, your urine status. If you're a man above the age of 40, PSA. Women and men will do cholesterol, and then you can now build up. You can get those. Those are the top 75% of diseases. And then down the road, we can now do the rest of the testing. So it can, I mean, you could do some of these basic tests for 50K and get out of there. And you know, you're doing it for a year. If you're younger, you're doing it for multiple years. So it's the best advice I can give is that when you come for your comprehensive screening, talk to your doctor and be open about your budget. If our kind of hospital, we have a la carte, so we don't look at your shoe or the car you drove into and change the prices. It's just a price list. And if you say you can't do the whole comprehensive, we can pick and choose just to make sure that we're still helping you as much as possible.
Right. Okay. Thank you so much. So I think when people hear 50K, they're like, oh my God. And when people hear 50, they're like, oh, but then they don't realize how long the screening would be for, and that's just a small investment that you can, put in for the benefit of your health. Also, you don't have to go all the way to maybe private hospitals. You can go to general hospitals. The wait might be longer, but it might be, considerably cheaper to go there. So there are options available. Please, let's make sure that we take advantage of those options. Okay.
We need more community-based screening, workplace screening, church and mosque screening, market outreach. I participate in any of these, especially when I'm asked. It's very important. I'm getting subsidized some of the screening. And you made a good point. You can do this in government hospital. It should be a little bit cheaper, but a little bit more stressful. The main thing is that you actually do the screening and you get your result.
Alternatives that we can just think about it as an investment for your health and for your future, because it's very, very important. Okay. All right. So what about lifestyle choices, Dr. Abiola's favorite topic?
My favorite topic.
How does this impact, the need for frequent screenings?
Yes, I love talking about a healthy lifestyle. Yes, do your best, but try and be healthy. It reduces your risk. It doesn't remove the need for screening, but a person who eats well, exercises well, sleeps well, avoids smoking, reduces alcohol, maintain a healthy weight, you may need less frequent advanced testing. So than a high risk person, but you still need periodic checks because genetics, age, stress, infections, they can all play a role at any time. So lifestyle and screening typically work together. Your lifestyle can reduce your risk, and screening can identify or confirm what's happening in the body before it's too late.
Before it's too late. Yes. Okay.
Nobody will enjoy their money. I don't care how much money you have. You can have $1 billion in the bank. If you develop advanced prostate cancer, you will be miserable. You will not enjoy your thing. If you develop kidney failure and you have 2.5 billion naira in the bank account, you will not enjoy life. It's so much better to catch these things early. Where medication could play a role, lifestyle choices can play a role before you're now reduced to open heart surgery and/or dialysis. It's such a big difference that it just makes it seem like screening is unavoidable. Really, it should not be an option. They spend $1 trillion a year in the U.S. just to treat these types of diseases. $1 trillion. And what I say, things that are avoidable, things that you could catch and fix with lifestyle, obesity, smoking, alcohol, cholesterol, those kind of things. So we really need a lot more of this.
All right. Okay. Moving on to this question, Dr. Abiola. There's this myth that is it a myth? People, let me just say this the way I want to say it. People commonly say, oh, I don't go to, especially like Yoruba people. I don't know of other tribes, but I've seen this with my people. And if you do too much screening, you can have cancer. The whatever, the radiation from the screening will affect you. I know someone, and I'm not even that the wife shouldn't do scans, and I remember being so livid, and his reason was because he didn't want to increase the risk, radiation for the baby, what else, cancer, like just some crazy stuff. That's the only way I can put
Mm-hmm.
it. Please, can you debunk this? Because people actually think that when they go for screenings, it affects the baby or it affects the health of whoever. And I don't know who did this to us. Somebody did, sharp, but
You that does an X-ray once every 2-3 years, it's not at
Mhm.
risk. You pass through the airport, you're exposed to X-rays and little X-ray things everywhere. How come the man working the X-ray line
Is
doesn't have cancer?
yeah.
So it's just misguided miss. Um, you can have anxiety from abnormal results or false positives. You know, the radiation exposure for CT and X-rays, can increase your cost, but that's why I always come back to the point that it should be medically guided. So if you're pregnant, I may not do an X-ray on you if I don't have to. But I still do X-rays for pregnant women from time to time. It happens.
Hmm.
So yeah, I don't like the advice because the scanning, of a pregnant woman is important. So you see the position of the baby, see the baby's
Yeah.
health and everything, and that should be done as frequently as needed. A minimum of 3 times during the pregnancy. But I have some women that get scanned 10 times in pregnancy for one reason or another, and it's completely fine.
Okay. All right. Thank you so much for that. Because I can't remember who it was, especially the person's picture, face, and name skips me. But I remember being so livid, and I was like, "Who do you think you are?" And the both was like, my husband said I was just so livid. But yeah, please, 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 doctor. We have a doctor that has debunked this myth. Nothing is happening to you if it happens. If it's a case of radiation, then you shouldn't be using your phone. You shouldn't be watching TV. You shouldn't be using your laptops. What else again?
Right?
The things you shouldn't be using microwave. You shouldn't be using anything at all that you think there's
Those are good
radiation.
points.
You shouldn't be using your generator either.
Those
Just
are
go
good
about life
points.
like you're in the Stone Age or
Dry.
something.
Dry.
Yeah. And the thing is, at the end of the day, too much of everything is bad. So
True.
it's knowing how to live in moderation or use things in moderation. For instance, with my son, I was having scans every week. And for me, it was not even a case of I never that thought never crossed my mind. It was more of this baby has to leave and I have to leave. So they need to be watching as the baby was progressing. It didn't cross my mind. So when this is a situation like that where they need to be checking you every week, why would you say and you will get cancer from it? Oh, gosh. We need to wake up and smell the cabbage,
We
okay?
need to we need to the number one issue in healthcare is ignorance, and especially in
Absolutely.
Nigeria. If we can avoid that, then things like screening become more popular and makes more sense.
Yeah. Yeah, because I think that's a major reason why a lot of people, especially older people, don't want to go. So when I see a younger person that says this, I'm like, wow, and you're a young person, how come? Okay, so the say I came into ROA this morning. I wanted to do a comprehensive screening. What is the process? Do I need to prepare beforehand? Is there a case of I shouldn't eat before coming? What do I need to put in place before I come to ROA to do a screening?
So preparation, and I'm prepared for this question because this usually disturbs me when I'm reviewing somebody for a comprehensive.
Okay.
First of all, you should come with all your previous test results if you have them. Whether it's a
Okay.
picture or the actual report, bring all your previous test results. It's important. Let the doctor see. Most patients will tell me, "Oh, so one doctor checked it and it was okay." No, let me see the
Yeah.
results because I'll tell you what's okay. Come with a
Yeah.
list of all your current medications.
Okay.
Very, very important. Then I've had a patient that brought out the current medications, and from that medication, I asked him, "What problems do you have?" He said one or two. I looked at his drug. I said, do you have prostate cancer? Oh, yeah, 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 yeah. Really?
He did
But
not.
it's,
I
it's
did. What?
but it's by looking at his empty medicine bottle that I now introduced that, which was a huge one. So have your current medications, know your family history. We've talked about the importance of that for screening. And you can either ask whether it's fasting or it's usually safe to fast before you're coming because a lot of those tests are fasting blood sugar, fasting lipid, which is cholesterol. So, of course, avoid alcohol before testing. Try and sleep well and drink water the night before. And that's those are some of the main things. And I had one more. Be honest. You know, you're not supposed to lie to your lawyer, your doctor, and your pastor, right? So be honest about smoking, alcohol,
Right.
sexual
Nobody
history,
can you.
your your lifestyle. Don't
Yeah.
hide symptoms. Be honest about those things because all that information can really save you time, money, and save your life in the right hands.
Okay. Thank you so much. Thank you so much for that because a lot of us go the only time we sort of prepare to go for anything is maybe you need to get a procedure done and then they tell you what to do. But most times we never like for screenings and stuff like that, that's not something that we really know what to do when we are going. So what should a person do if the screening now comes back abnormal? You were expecting one result, it was something else that came out. What does the person do?
So the just as important as the screening itself, the consultation is just as important. We're building a site now, it should come out any day now, where you can do these consultations online with your lab results. So I mean, you just need some basic interpretation. Number one, you asked about what should a person do if it's abnormal. Number one, don't panic.
Right.
Number two, because abnormal results it could be a false positive. It could need a confirmation test.
Right.
All these tests, all these results need proper interpretation in the context of the patient, right? So do not panic. Do not run to Google, and because Google will list everything.
So Tabiana,
Yeah,
just call my name. Call my name. Just call my
Dr. Google.
That's me. That's me.
But you're gonna see everything, and you'll play into that panic, into that
Mhm.
anxiety. You'll say could be this, could be this. Once you see cancer, bleeding, and death, you now feel like that's gonna happen to you. So the person, the patient should see the doctor with all the results, not just treat themselves based on one number. So, for example, if I see one high blood sugar, I may bring them back another day to confirm. If I see one high blood pressure, I may bring them back another day to confirm. And some of those people, we end up not putting on medication. We just do
Right.
lifestyle changes. So the worst thing to do is ignore the result because there's no pain, there's no warning sign. And then I would say secondary is not to have a proper consultation. This is why
Mm.
we're building our site and we're having that free consultation with your lab test. You can do it from your car, you can do it from your bedroom. So, because a lot of people have stigma of going to the hospital.
Yeah.
Some patients think that once you go to the hospital, you're going to get a disease. But once
Mhm.
you screen for high blood pressure, you're now going to become hypertensive, right? And it's just not the case.
Mm. All right. Thank you so much, Dr. Biela, for today's free consultation on the importance of comprehensive screening. And we've gone through like a long list of what it is, why you need it, who needs to do it, the diseases that will be prevented if you do it, how much it is, why you should do it, where you can do it. She's also called
Hmm.
up churches and mosques, philanthropists to even like let's do this even more for people. It's some sort of like CSR, for the less privileged, for people who can afford to go to the hospital itself. Thank you so much, Dr. Vela, for coming on the program today. You can
Can I say one last thing?
yes, please, you can go ahead.
So I want to invite, we want to give a little advice. So I want to invite 20 people to know your numbers for free. So know your blood pressure, know your blood sugar, know your weight, know your BMI, know your cholesterol, know your kidney function. Women
Yeah.
will do breast
Ah,
cancer screening. Um, 20 people can contact me, ROA Specialist Hospital, on all the social medias, www.theroahospital, theroahospital.com, or call 0913-579-5108, 0913-579-5108, or 0808 888-6263635 and mention WFM and that Dr. Ajay opened his mouth to give away
Yes.
some tests and my people, or I will respond.
Me, I'm owing myself plenty tests. Hell, and I was like, okay, I'm owing myself. The day I come, I'll come prepared that, okay. And I'm coming, I'm not going to wait for anything. Just be like, oh, your MD's one, I said I should come and do my test now. That's what I'm going to do. So all
No
my
problem.
Because the only thing I know my blood pressure is. I can't remember what it was the last time. I know it was normal, but I don't know what it was the last time. My mom, on the other hand, is a professional blood pressure taker, so she knows her blood pressure. So yes, Dr. Bella said we should know all these things. He's giving the number to call and how you can reach him. So please reach Dr. Abiola. Once again, thank you so much, Dr. Abiola, for today's free consultation on the importance of comprehensive screening.